Hello, welcome to another episode of Facebook Live. I'm Jen Bentley. I'm the dermatologist here at Veterinary Referral Center of Central Oregon, and we are going to be talking about all things about ears. So please chime in. Now is your chance to ask questions, any questions you have about ears infections in both dogs and cats. As always, we've got Denali taking your questions in the back, and Shelby is manning the video camera. But I'll get started with talking about ears, but please feel free to interrupt and ask those questions as well. Probably if you're watching this video, you already know some common symptoms of ear infections or itchy ears, and that includes, of course, shaking the head, pawing at those ears, and sometimes even rubbing the ears against the ground as well. So those are all signs that there's irritation within the ears, and we call that otitis externa, which is just a fancy word to say inflammation of the external ear canal. Doesn't necessarily have to mean they're infected. Inflammation can also be very itchy as well. So usually when you bring your dog or cat to the vet with these symptoms, the first thing they're going to be doing is getting some cytology, where they stick a swab inside those ears, roll that out on a slide, and look at it under the microscope. And so they're looking for evidence of infection, either with bacteria or yeast, and also how bad it is too, because that can help you with prognosis and help you guide your treatment recommendations. We also, at the time of examination for all of our ear patients, look into the ears with an otoscope, just like this. Pretty handy and easy to use. But looking at the ear canal is also very important when we have animals with itchy ears, because it can also help guide our treatments. How bad is the inflammation in the ear? Are there erosions, ulcerations that need to be dealt with and fixed? We also look at the integrity of the eardrum or tympanic membrane as well, which can help guide our treatment process too. For most cases of chronic or acute otitis externa, it's pretty simple. You treat with usually a topical therapy. Sometimes you add on an anti-itch therapy as well, like steroids or Apoquil. And symptoms usually go away in about a week. And usually you're on these treatments for about 3 weeks to make sure things are fully and completely gone. At around that time, when you get more cases of otitis externa, that's where things get a little bit more complicated, and it's not just a simple ear infection. And for all ear infections, there's always this underlying cause, and so that's what the difficult part of it is. So it's easy to resolve inflammation, it's easy to resolve infection. The difficult part is finding out what is causing the otitis externa in the first place. Some people will blame otitis externa on swimming or dogs with very floppy ears. That's not really the case. There's lots of dogs with floppy ears out there that do just fine and don't have ear infections. So when we're talking about causes of otitis externa, those include probably about 80% of the dogs I see, allergies is causing otitis externa. And allergies does this, no matter which one, food or environmental, by causing inflammation of the skin and also the ear canals, which is essentially skin. And then that leads to infections. There's other causes, depending on the age of the dog. Endocrine type of diseases can also cause otitis externa. So diseases that affects the immune system, particularly the immune system of the skin. And that includes hypothyroidism and also Cushing's disease. So depending on the history and presentation, we may be checking for those as well. If we have ear infections that don't affect both ears and affect one ear, that's where we get concerned about things like foreign bodies or even masses inside the ear canal as well. Cats like to get polyps inside the ear canal. So those are a few of the underlying causes, but ear infections cannot be simple. They can also be very chronic, and then that can lead to a host of other problems too. So what happens when we have chronic ear infections is there's a lot of changes to the ear canal. And one big thing that can happen is you can get what's called otitis media or middle ear disease. So what happens in those cases, so I'll just go through a little bit of anatomy with you guys. So this is the external ear canal, and in dogs it's actually L-shaped, which is very different from humans. It makes it difficult to visualize this horizontal ear canal down here. But if you're good with the otoscope, you can definitely do it. This is the middle ear canal, this kind of bony pocket right here. It's past the tympanic membrane or the eardrum. When you have long-standing ear infections or chronic, basically otitis externa here, what can happen is that infection can go through the tympanic membrane and cause a middle ear infection. And that's really, really difficult to treat because your topical therapy is difficult to reach down here. And even oral therapy that reaches different places by the bloodstream, well, this is like a bony pocket. So these blood vessels, they don't really go here too. So actually the only therapy that we truly have that's recommended is to go in here, break open the tympanic membrane if it's sealed back up, and flush this area out. Now it looks like we have a question.
Oh, this is just, Jen, I'm thinking it was people could see that pretty well, but you might want to walk it a little bit closer and they could get that detailed look at what you're talking about.
Yeah.
There you go.
Better. Okay, so again, this is the external ear canal here, middle ear canal, and then this is the tympanic membrane right here. And this is pretty much the same in felines as well. So when we're talking about middle ear disease and flushing that out, it's also very complicated because we may not know there is middle ear disease. In fact, the only way to know that there's middle ear disease is one, if we have a ruptured tympanic membrane, then by definition you do. And two, if we actually do a CT scan. Unfortunately, x-rays, you can't do an x-ray to see the middle ear canal. It's a bony pocket. X-rays don't penetrate that. So unfortunately, the advanced diagnostics with the CT is the only way to truly evaluate that. So we do that under anesthesia, and then we go in and we flush the area usually afterwards if it confirms that yes, indeed, we have otitis media. Looks like we have a question.
We do. We have a question from McKenna. And she would like to know if you have heard of dogs being allergic to the ear wash prescribed by the vet.
Yes.
It's called keto something.
So there are lots of cases where dogs actually have a contact allergy to medication. So, and this can actually happen with any medication or any ear wash. So just like us, we can be allergic to multiple different types of topical therapies, and we just don't know which one or which one it is. There's no therapy that I have seen that I say, hey, I'm staying away from this because I see a lot of contact allergy from it. It's unfortunately just luck of the draw. But it gets a little bit complicated because you definitely want to scan those ingredients in there and make sure you're not using the same thing if you need to use something else for ear medications. Usually when I see those types of reactions from ear medications, we're usually actually seeing it most pronounced on the pinna or the orifice. So that's where it usually gets very red and ulcerated. And actually a lot of times with these contact cases, I'll look in and that horizontal part of the ear canal looks completely fine. And it's really the vertical and outside of that ear canal that's looking really bad. So that's what usually tips me off that we're allergic to one of these medications. But fortunately, it rarely happens, and I'm sorry, it sounds like you're in that category that it happened to. And then I just want to show you guys kind of the fancier tools that we use to look at the ear canal. We use this guy, which is a video otoscope. And basically, we can use this port to pass through instruments, graspers to grab debris out of the ear. This part's connected to a light source, and then this part's a camera. So we can get very, very good pictures with this. We can evaluate the ear very, very well with this type of instrument because basically we get more light through here and we get a really nice picture of the ear canal with this. And of course, this is the only way to do what we would say is a deep ear flush. And by deep ear flush, I mean we go into the middle ear canal. As you can imagine with something like this, you can't do a deep ear flush with this. It's not going to give you enough visualization down there to be able to actually clean out the ear canal as you would want to. So that's a little bit about middle ear infections. Fortunately, we don't see those too often, and they get a little bit hard to deal with. It's usually about 2 months of dealing with these types of ear infections. Some ear infections, and hopefully you guys don't fall into this stage, they're actually end-stage ears. And what the ear canal does after years and years of being infected and having inflammation is the skin in there actually says, okay, I'm gonna build up more skin and I'm gonna harden that skin and I'm actually gonna calcify that skin. And so there's animals out there who literally their whole ear canal is basically one big piece of bone. It can get that bad. And at that case, we send them over to the surgeons and they do a procedure called a total ear canal ablation and bulla osteotomy, and the ear canal is actually removed. And unfortunately, we do those quite often, and hopefully, by working with your vet, by working with your dermatologist, you can prevent to getting to that stage by working on those underlying causes and keeping that inflammation down, because that's what we don't want to get to, is doing this surgical procedure. As far as things you can put down into the ear canal and home remedies, I've seen a lot. I always urge people not to do home remedies. So one of the common ones is actually water and vinegar, which I will use on different parts of the skin like the feet. Vinegar is great for killing yeast, but in the ear canal, it's hard for owners to evaluate that, of course. You can't see into the horizontal ear canal. But if there are ulcerations and erosions in that ear canal, then putting a solution of water and vinegar is not a good idea. It's just gonna sting and it'll also be more irritating. And then you're gonna have a dog that is gonna be scared every time you go to put something into that ear. So I would stay away from that unless you've had a veterinarian confirm that there's no erosions down there. And even then, there's better products that we can use for those types of infections. Other things that I've seen, a lot of people like to put oils down there. I've seen some people put like oregano oil and rosemary, and it almost sounds like a salad dressing to me. Again, oils probably aren't that harmful to the ear canal. They could break up wax, but depending on what the problem is, usually it's not just waxy buildup. The waxy buildup is due to something else. So you're not really improving the state of the ear canal just by throwing oils down there. Other things that I've seen is witch hazel, which is an astringent, meaning it dries things out, which sounds really nice in the ear canal. But again, if you're putting that in with erosions and ulcerations, it's just gonna be super, super irritating. The other thing you have to be careful about is these products that aren't really designed to be used necessarily in ears or on the human bodies. They may not have done the microbiology testing. And in fact, I had a case where an owner was putting witch hazel on the skin of a dog, and the dog kept getting infected, and it wasn't a staphylococcus, which is a normal infection. It was something else. I can't remember off the top of my head now, but I had a couple culture plates sitting around, so I took the witch hazel, put it on a culture plate, and it grew a ton of bacteria. So you really, really have to be careful with some of these over-the-counter therapies because they're just not tested as, basically regulated as much as some of these other products that the veterinarians are recommending it. The other thing is I at least am very specific with the products that I recommend for each type of condition. And I base it on how the ear looks and how the cytology is. So I'm not just picking something randomly. A lot of my patients who have chronic ear infections, we're treating for allergies, I'll put them on an ear medication or an ear flush that actually has hydrocortisone in it. So we can get a little bit of topical steroids down to tone down that inflammation. So what happens in these guys is that the inflammation leads to the infection. So if you can treat and tone down that inflammation, you can hopefully prevent some of these infections from occurring. So that's a little bit about ears. Of course, as always, we take our questions afterwards as well, so don't be shy. Please let me know what questions you have. Ears are always a little bit complicated, and the cases can be, not straightforward, so I'm happy to answer anything. But that is it for our discussion. Thank you for joining us.